13 Early signs of heart failure you should never ignore. Heart disease remains one of the leading causes of illness in the United States. And over 6 million Americans are currently living with heart failure. What's concerning is that most people fail to recognize the early warning signals. Instead, they blame these changes on stress, aging, or simply being out of shape. But here's the truth, your body often warns you long before a crisis happens. Recognizing these subtle red flags can help you take action early, when treatment is most effective. Let's explore 13 early symptoms of heart failure that many people overlook. 1. Shortness of breath with simple activities. Feeling winded after jogging is normal, but if climbing one flight of stairs, walking across a parking lot, or even carrying groceries leaves you struggling to breathe, it may be your heart's way of saying it can't keep up. This happens because the heart isn't pumping enough oxygen-rich blood to the muscles, forcing the lungs to work harder. 2. Needing extra pillows at night. Do you suddenly need 2 or 3 pillows, or even a recliner, just to sleep comfortably? This condition, called orthopnea, happens when fluid backs up into the lungs while lying flat. It's a very common but often ignored sign of heart failure. 3. Waking up gasping for air. Some people are jolted awake in the middle of the night, feeling like they're suffocating. This frightening symptom, known as paroxysmal nocturnal dyspnea, occurs when fluid shifts back into the lungs after lying down for a few hours. 4. Extreme fatigue. This isn't the tiredness that disappears after a nap. It's a persistent, draining exhaustion that makes everyday tasks, like walking the dog, taking a shower, or climbing stairs, feel overwhelming. When the heart can't deliver enough oxygen to the muscles, even simple chores become exhausting. 5. Swelling in the legs or ankles. Notice your socks leaving deep marks or shoes feeling tight by evening? Persistent swelling in the ankles, feet, or legs, called edema, is another hallmark of heart failure. It happens when blood flow slows down and fluid builds up in the tissues. 6. Rapid weight gain in days. If you gain 2 to 3 pounds overnight or more than 5 pounds in a single week without changing your diet, it may be due to fluid retention. Doctors often recommend that heart failure patients weigh themselves daily, because sudden weight gain is one of the earliest measurable warning signs. 7. Frequent nighttime urination. Waking up several times a night to urinate, called nocturia, can happen when fluid that pooled in the legs during the day returns to circulation at night, forcing the kidneys to work overtime. 8. Night cough or wheezing. A nagging cough that appears when lying down at night but improves when you sit up may be a sign of fluid in the lungs. Sometimes this cough even produces pink, frothy mucus, a clear red flag that needs medical attention. 9. Irregular heartbeat or palpitations. If your heart feels like it's fluttering, racing, or skipping beats, especially when resting, it could be a sign of arrhythmia. These abnormal rhythms often accompany heart failure and can worsen the condition if left untreated. 10. Dizziness or near fainting. If you often feel lightheaded, especially when standing up quickly, it could be because your weakened heart isn't supplying enough blood to the brain. Some people even faint, another serious warning sign that shouldn't be ignored. 11. Digestive issues and bloating. Surprisingly, heart failure doesn't only affect the heart. When blood flow to the digestive organs is reduced, it can cause persistent bloating, nausea, loss of appetite, or feeling full after only a few bites. Fluid buildup in the abdomen can also add to the discomfort. 12. Shortness of breath when bending forward. Ever felt breathless just by tying your shoes or leaning over a sink? This condition, called bendopnea, is a highly specific warning sign of elevated heart pressure and is strongly linked to heart failure. 13. Cold hands, cold feet, or narrow pulse pressure. If your hands and feet are often cold, even in warm weather, it could be because your body is redirecting blood flow away from the extremities to keep vital organs alive. A reduced difference between your upper and lower blood pressure readings, known as narrow pulse pressure, can also be an early warning sign. These symptoms can come on gradually and are easy to dismiss as stress, poor sleep, or just getting older. But if multiple symptoms appear at once, or if daily activities suddenly become more difficult, it's time to see a doctor. The good news is that heart failure is treatable, especially when caught early. With the right combination of medications, lifestyle changes, and monitoring, people can manage the condition and continue to live active, fulfilling lives. Your body is always sending signals. It's important to listen before it's too late.